The clock on the wall showed 8:47 p.m. when 8-year-old Tommy burst through the emergency room doors, tears streaming down his face as his grandmother held him close. The automatic doors whooshed shut behind them, sealing out the cool evening air and the sound of distant traffic. Inside, the harsh fluorescent lights made everything feel cold and unwelcoming. "Please, someone help us," called out Mrs. Betty Johnson, her voice carrying both urgency and the kind of calm that comes from raising 6 children and countless grandchildren. At 73, she had seen her share of emergencies, but the sight of Tommy's leg bent at an unnatural angle made her heart race faster than it had in years. Tommy clutched his grandmother's worn coat, his small frame shaking not just from pain but from fear. The accident kept replaying in his mind like a broken record. He had been racing his friends on their bikes down the hill near their apartment complex when his front wheel caught a pothole. The world had spun around him before everything went black for a moment. When he opened his eyes, his leg was twisted in a way that legs weren't supposed to twist. The waiting room buzzed with its usual evening activity. A teenage girl sat in the corner holding an ice pack to her wrist while her mother filled out paperwork. An elderly man coughed into his elbow while his son rubbed his back gently. 2 paramedics wheeled in a patient on a stretcher, their radio crackling with medical codes that sounded like a foreign language to most people waiting. Mrs. Johnson approached the reception desk where a young nurse with kind eyes looked up from her computer screen. "My grandson fell off his bike. His leg is broken really bad. He needs help right away." The nurse, whose name tag read Lisa, took one look at Tommy and immediately grabbed a wheelchair. "Let's get him comfortable first, and then we'll have someone take a look at him right away." As Lisa helped Tommy into the wheelchair, he let out a soft whimper. The movement sent sharp pain shooting up his leg like lightning bolts. Mrs. Johnson handed over their insurance card with slightly trembling fingers. It was a Medicaid card, worn from being carried in her wallet for so many years. "The doctor will see him soon," Lisa assured them, though her smile seemed a bit forced. She had worked at Riverside Medical Center long enough to know that some of the doctors treated Medicaid patients differently, and she hoped tonight wouldn't be one of those nights. Dr. Richard Stone had been working at the hospital for 15 years. He was known for his skill with broken bones and complex surgeries, but also for his short temper and strong opinions about who deserved his time and expertise. As he finished up with his last patient, he was already thinking about getting home to his suburban house and the golf tournament he planned to watch. When Lisa knocked on his office door to tell him about the new patient, Dr. Stone barely looked up from his paperwork. "What is it now?" "I was about to leave. 8-year-old boy with what looks like a bad leg fracture. He's in room 3 with his grandmother." Dr. Stone sighed heavily and grabbed his stethoscope. As he walked down the hallway, his shoes clicked against the polished floor with each step. He was tired, hungry, and not in the mood for what he assumed would be another lengthy case with complicated insurance issues. When he pushed through the curtain to room 3, his assumption seemed to be confirmed. Tommy sat on the examination table, his grandmother beside him holding his hand. Their clothes were clean but clearly not expensive. Mrs. Johnson's purse was an old leather bag that had seen better days, and her shoes were practical rather than fashionable. Without introducing himself or making eye contact with either of them, Dr. Stone glanced at the chart. "Medicaid," he muttered under his breath, though not quietly enough that Mrs. Johnson didn't hear. "Doctor, please look at his leg," Mrs. Johnson said respectfully. "I think it might be broken in more than one place. He's in so much pain." Dr. Stone barely glanced at Tommy's leg. From where he stood, he could see swelling and bruising, but he didn't move closer to examine it properly. Instead, he scribbled something on his clipboard. "Kids fall off bikes all the time. Probably just a sprain. Give him some ice and children's pain medicine. He'll be fine in a few days." Tommy looked up at the doctor with confused eyes. Even at 8 years old, he could tell something was seriously wrong with his leg. It hurt worse than anything he had ever felt before, and he couldn't move it without wanting to scream. "Doctor, with respect, I raised 6 children and helped raise 12 grandchildren. This isn't a sprain. Please take another look." Dr. Stone's expression hardened. He didn't like being questioned, especially by people he felt were wasting his valuable time. "Ma'am, I've been practicing medicine since before your grandson was born. I think I know the difference between a sprain and a fracture." The nurse, Lisa, stood quietly in the corner. She had been working in emergency rooms for 8 years, and she could see that Tommy's injury was serious. The way his leg was positioned, The severe swelling and the child's obvious pain all pointed to a significant fracture, but she also knew Dr. Stone's reputation and was afraid to speak up. Mrs. Johnson tried again, her voice still polite but with an edge of desperation. "Dr. Stone, please. I'm not trying to tell you how to do your job, but this child is hurting something terrible and I can see his bone isn't right. Could you please just take a closer look?" "Listen," Dr. Stone said, his voice growing colder. "This emergency room is for real emergencies. We can't waste time and resources on every little bump and scrape. There's a community clinic downtown that opens in the morning. Take him there if you're still worried." He turned to leave, but Mrs. Johnson's voice stopped him. "Doctor, we've been waiting here for over an hour. My grandson is in pain. Isn't your job to help sick children?" Dr. Stone turned back, his face showing clear irritation. "My job is to handle serious medical emergencies, not to babysit every child who falls off their bike. The clinic will give you the same advice I'm giving you now. Ice, rest, and over-the-counter pain medication." Tommy started crying harder, not just from the physical pain but from the fear and confusion of hearing adults argue about whether he really needed help. His grandmother pulled him closer, whispering soothing words while her own heart broke watching him suffer. Lisa finally found the courage to speak up. "Dr. Stone, maybe we should take an x-ray just to be sure." The doctor's sharp look silenced her immediately. "Nurse, I don't need you to tell me how to diagnose patients. Please discharge them with standard instructions for minor injuries." As Dr. Stone left the room, Mrs. Johnson felt a combination of anger, fear, and helplessness wash over her. She looked down at Tommy, whose tears had left tracks on his dusty cheeks, and made a decision that would change everything. "We're not leaving, baby," she whispered to her grandson. "Grandma's going to make sure you get the help you need." Mrs. Johnson helped Tommy back into the wheelchair, her mind racing as she tried to figure out what to do next. The hospital discharge papers in her hand felt like a joke. Instructions for treating a sprain when she could clearly see her grandson's leg was seriously injured. The swelling had gotten worse in just the past hour and Tommy's face was pale with pain. "Where are we going, Grandma?" Tommy asked weakly as she wheeled him back toward the waiting area. "We're going to sit right here until someone helps you properly," she said, her voice gentle but determined. She positioned the wheelchair near the reception desk where she could keep an eye on the medical staff coming and going. Lisa, the nurse who had tried to help earlier, walked by and gave them a concerned look. Mrs. Johnson caught her eye and waved her over. "Excuse me, dear. I know that doctor said to take my grandson home, but look at his leg. Does this look like just a sprain to you?" Lisa glanced around nervously before kneeling down to Tommy's level. Up close, she could see the injury was even worse than she had first thought. The child's lower leg was clearly deformed, and the skin was starting to change color in ways that suggested serious internal damage. "Ma'am, I'm not allowed to go against Dr. Stone's diagnosis," Lisa whispered. "But if I were you, I would try to get a second opinion somewhere else as quickly as possible. We tried 3 other hospitals on the way here," Mrs. Johnson explained. "They were all full or said their wait times were 4 to 6 hours. This was supposed to be the closest one with a good children's emergency department." Lisa's heart sank. She had seen situations like this before where patients fell through the cracks of the healthcare system, but never with a child who was so obviously in need of immediate care. "I have to get back to work, but I'll keep checking on you, okay?" Lisa said, squeezing Mrs. Johnson's hand gently before walking away. For the next 2 hours, Mrs. Johnson and Tommy became fixtures in the waiting room. Every 20 minutes or so, Mrs. Johnson would approach a different staff member, another nurse, a medical assistant, even a janitor who looked like he might know something about hospital procedures. "Excuse me, could you help us? My grandson needs to see another doctor. His leg is broken, but Dr. Stone said it was just a sprain." Most of the staff looked at her with sympathy, but explained they couldn't override a doctor's orders. A few suggested she take Tommy to a different hospital, but Mrs. Johnson had already called around. The nearest hospital with availability was 40 minutes away, and she was afraid to move Tommy that far with his injury getting worse. Tommy dozed fitfully in the wheelchair, waking up every few minutes when the pain shot through his leg. Mrs. Johnson used her phone to call her son, Tommy's father, but it went straight to voicemail. She left a message explaining the situation, her voice cracking slightly as she described how scared she was. Around 11 p.m., a different doctor walked through the emergency department. Dr. Angela Martinez was finishing her shift in the pediatric wing when she noticed the elderly woman and young boy who had been sitting in the same spot for hours. She had heard whispers from the nursing staff about Dr. Stone's earlier dismissal of the case, and something about the situation bothered her. As a mother herself, she couldn't imagine being told her child's obvious injury wasn't worth examining properly. Dr. Martinez approached them carefully. She had learned to be diplomatic when dealing with cases that involved other doctors' decisions. But she also couldn't ignore a child in pain. "Hello, I'm Dr. Martinez. I work in the children's department here. I couldn't help but notice you've been waiting for a while. Is everything okay?" Mrs. Johnson's eyes filled with hope for the first time in hours. "Doctor, my grandson fell off his bike and hurt his leg really bad. Dr. Stone looked at it and said it was just a sprain, but I know something's not right. The child can barely move without crying." Dr. Martinez looked down at Tommy, who was trying to be brave but couldn't hide the pain written across his young face. "Tommy, is it okay if I take a look at your leg?" "I promise I'll be very gentle." Tommy nodded, though he gripped his grandmother's hand tighter. Dr. Martinez knelt beside the wheelchair and carefully examined Tommy's leg without moving it. What she saw made her stomach drop. This wasn't just a fracture. It looked like a compound fracture that needed immediate surgical attention. Every minute that passed without proper treatment increased the risk of permanent damage. "Mrs. Johnson, I need to be honest with you. This injury requires immediate attention. I'm not sure why Dr. Stone didn't order x-rays, but I can see this is serious. Can you help us?" Mrs. Johnson asked, hope and desperation mixing in her voice. Dr. Martinez hesitated. She was technically off duty, and overriding another doctor's diagnosis could create professional problems for her. But looking at Tommy's pale face and obvious pain, she knew she couldn't walk away. "I'm going to order some x-rays right now," she said. "Then we'll know exactly what we're dealing with." As Dr. Martinez headed to the computer to input the x-ray order, she ran into Dr. Stone coming back from his break. He had been in the doctor's lounge, complaining to colleagues about difficult patients and insurance issues. "Richard, I need to ask you about the Johnson case and the 8-year-old with the leg injury." Dr. Stone's face immediately showed annoyance. "Don't tell me that woman is still here bothering the staff. I already told her it's just a sprain. Some people just don't listen to medical advice. I took a look at the child and I really think we need x-rays. The injury appears more serious than..." "Angela, with all due respect, I examined the patient. I've been practicing orthopedics for 15 years. I think I know a sprain when I see one." Dr. Martinez felt her professional training warring with her instincts as both a doctor and a mother. "Richard, the child has been sitting in our waiting room for hours in obvious pain. What's the harm in taking a few x-rays to be absolutely sure? The harm is wasting hospital resources and setting a precedent that every parent who disagrees with a diagnosis can demand additional tests. If we did x-rays for every child who fell off a bike, we'd be bankrupt. But this case is closed, Angela. The family has discharge instructions. If they choose not to follow them, that's not our problem." Dr. Martinez watched Dr. Stone walk away and felt a sick feeling in her stomach. She looked back toward the waiting area where she could see Mrs. Johnson trying to comfort Tommy, who was crying again from the pain. She made a decision that would later prove to be one of the most important of her career. Walking back to the computer, she quietly ordered the x-rays under her own name, knowing it might get her in trouble but unable to live with herself if she didn't at least try to help. 20 minutes later, a radiology technician came to get Tommy for his x-rays. Mrs. Johnson helped transfer him to a gurney, whispering encouragements as they wheeled him away. When the x-rays came back, Dr. Martinez's worst fears were confirmed. Tommy had a severe compound fracture with bone fragments that had already begun to shift. This was the kind of injury that required immediate surgery to prevent permanent damage or disability. Her hands shaking slightly, she called Dr. Stone's extension. "Richard, you need to come look at these x-rays right now. The Johnson boy has a grade 3 compound fracture. He needs surgery immediately." There was silence on the other end of the line before Dr. Stone replied in a tight voice, "I'll be right there." As Dr. Martinez waited for Dr. Stone to arrive, she looked out at Mrs. Johnson, who was pacing nervously in the waiting area, checking her phone every few seconds for a call back from her son. The older woman had no idea that the next few minutes would change everything for her family, or that her refusal to give up on getting help for her grandson was about to expose a much bigger problem at the hospital. Dr. Stone stared at the X-ray images on the computer screen, his face growing pale as the reality of what he was seeing sank in. The black and white images clearly showed exactly what Dr. Martinez had described: a severe compound fracture with multiple bone fragments that had already begun to shift, dangerously close to major blood vessels. This can't be right, he muttered, though he knew the images didn't lie. Dr. Martinez stood beside him, her arms crossed. Richard, this child has been sitting in our waiting room for nearly 4 hours with an injury that needed immediate surgical intervention. How did you miss this? Dr. Stone's mind raced as he tried to remember his brief examination of Tommy. He recalled being tired, wanting to get home, and making assumptions about the family based on their insurance and appearance. The truth was, he hadn't really looked at the injury carefully at all. We need to get him into surgery right now, Dr. Martinez continued. Every minute we wait increases the risk of permanent damage to his leg. Meanwhile, in the waiting area, Mrs. Johnson's phone finally rang. She answered it on the first ring, her voice filled with relief. Michael, thank goodness you called back. On the other end of the line, Dr. Michael Johnson was sitting in his car in the parking garage of Metropolitan Medical Center, where he served as the chief of pediatric surgery. He had just finished a complex 8-hour surgery on a young patient and was exhausted, but his mother's voicemail had sent ice through his veins. Mom, I got your message. Are you and Tommy still at Riverside? I'm on my way right now. Yes, baby. We're still here. A nice doctor finally ordered some x-rays for Tommy, but I'm so worried. He's in so much pain and it's been hours since his accident. Michael's hands tightened on the steering wheel. As one of the most respected pediatric surgeons in the state, he knew that delays in treating serious fractures in children could have lifelong consequences. The fact that his son had been waiting for hours with what sounded like a significant injury made him both furious and terrified. Mom, I'll be there in 15 minutes. Don't let anyone move him until I get there, okay? Mrs. Johnson felt a wave of relief wash over her. Her son would know what to do. Michael had always been the smart one in the family, the one who studied hard and made it through medical school despite all the obstacles. She was proud of the doctor he had become, even if his demanding schedule meant they didn't see each other as often as she'd like. When the radiology technician brought Tommy back from x-rays, Mrs. Johnson could see that her grandson was getting worse. His leg was more swollen than before, and his skin had taken on a grayish tint that scared her. Grandma, when is Daddy coming? Tommy asked weakly. He'll be here very soon, sweetheart. Just hold on a little bit longer. 15 minutes later, the emergency room's automatic doors burst open as Michael Johnson strode in, still wearing his scrubs from the surgery he had just completed. He was tall and moved with the confident urgency of someone accustomed to medical emergencies. But his eyes showed the fear of a father whose child was injured. He spotted his mother and son immediately and rushed over to them. Mom, how's he doing? Not good, baby. The pain seems to be getting worse, and look at his leg. Michael knelt beside Tommy's wheelchair and gently examined his son's injury. His medical training told him immediately what he was looking at: a severe compound fracture that should have been treated hours ago. His hand shook slightly as he touched Tommy's forehead. Hey, buddy, Daddy's here now. We're going to take really good care of you, okay? Tommy managed a weak smile. Daddy, my leg really hurts. The first doctor said it was just a sprain, but it hurts so bad. Michael's jaw tightened. He kissed his son's forehead and stood up, looking around the emergency department with the eyes of both a concerned father and an experienced physician. He needed to find whoever was in charge of his son's care and get him into surgery immediately. Lisa, the nurse who had been worried about Tommy all evening, noticed the new arrival and approached them. She had seen many worried family members over the years, but something about this man's presence seemed different, more confident, more knowledgeable about medical procedures. Excuse me, are you Tommy's father? Yes, I am. Can you tell me who's been treating my son and what the current plan is? Dr. Martinez just ordered x-rays, and I believe she's reviewing them now with Dr. Stone, who first examined Tommy when you arrived. Michael nodded. I'd like to speak with both of them immediately. This is clearly a surgical case that needs immediate intervention. Lisa paused, studying Michael's face. There was something about the way he spoke, the medical terminology he used, and his understanding of the situation that made her wonder. I'm sorry, but are you in the medical field yourself? I'm Dr. Michael Johnson, Chief of Pediatric Surgery at Metropolitan Medical Center. Tommy is my son. Lisa's eyes widened. She had heard of Dr. Johnson. His reputation as one of the best pediatric surgeons in the region was well known throughout the local medical community. She suddenly understood the full scope of what had happened that evening. Dr. Johnson, I'll get Dr. Martinez and Dr. Stone right away. They're in the radiology department looking at Tommy's x-rays. As Lisa hurried away, Michael turned back to his mother and son. Mrs. Johnson was looking at her son with a mixture of pride and confusion. Michael, I don't understand. Why didn't they help Tommy right away when they knew you were a doctor? Mom, they didn't know. You told them Tommy's last name was Johnson and you used your insurance information. They had no idea who I was or what I do for a living. Mrs. Johnson felt a cold realization settling in her stomach. You mean they treated us that way because they made assumptions about us based on how we looked and what kind of insurance we had, Michael finished quietly. His voice was controlled, but she could see the anger building behind his eyes. In the radiology department, Dr. Martinez was explaining the x-ray findings to Dr. Stone when Lisa appeared in the doorway. Dr. Martinez, Dr. Stone, I need you both to come to the emergency department right away. Tommy Johnson's father is here, and he's asking to speak with you immediately. Dr. Stone looked up from the x-rays with annoyance. Can't it wait? We're trying to figure out our next steps here. Sir, Tommy's father is Dr. Michael Johnson from Metropolitan Medical Center. He's the chief of pediatric surgery there. The color drained from Dr. Stone's face completely. Dr. Martinez looked between her colleague and the nurse, beginning to understand the implications of what had just been revealed. Dr. Michael Johnson? Dr. Martinez repeated. The Dr. Johnson who pioneered the minimally invasive pediatric fracture repair technique? Lisa nodded. He's been sitting in our waiting room for 4 hours with his injured son, while his mother begged for help. Dr. Stone felt the world spinning around him. Dr. Michael Johnson wasn't just any pediatric surgeon. He was one of the most respected doctors in the state, someone whose research had been published in major medical journals, someone who consulted on cases for hospitals throughout the region. Oh God, Dr. Stone whispered. What have I done? Dr. Martinez looked at her colleague with a mixture of disappointment and anger. Richard, you need to come with me right now. We have a lot of explaining to do. As they walked toward the emergency department, Dr. Stone's career flashed before his eyes. He thought about all the assumptions he had made, all the patients he had dismissed too quickly, and the professional reputation he was about to lose. But most of all, he thought about the 8-year-old boy who had suffered for hours because of his prejudice and carelessness. When they reached the waiting area, they saw Dr. Johnson kneeling beside his son, speaking in gentle, reassuring tones while his mother stood nearby with tears in her eyes. The scene that greeted them was one they would never forget. A family that had been dismissed and ignored, now revealed to include one of the most prominent doctors in their field. Dr. Martinez approached first, her voice professional but strained. Dr. Johnson, I'm Dr. Martinez. I'm the one who ordered the x-rays for your son. I want you to know that we're preparing to take him into surgery immediately. Michael stood and faced both doctors, his expression controlled but his eyes blazing with controlled fury. When he spoke, his voice was quiet but carried the weight of years of training and experience. Dr. Martinez, Dr. Stone, I think we need to have a very serious conversation about what happened here tonight. The hospital conference room had never felt smaller to Dr. Stone as he sat across from Dr. Michael Johnson. Hospital Administrator Patricia Williams had arrived within 20 minutes of being called, her professional composure barely hiding her panic at the situation unfolding under her watch. Tommy was now in pre-op, being prepared for emergency surgery by Dr. Martinez and her team. Mrs. Johnson sat with her grandson, holding his hand as the anesthesiologist explained the procedure they were about to perform. Despite the chaos of the evening, she felt a sense of calm knowing that her son was now handling the situation. In the conference room, Michael spoke with the controlled precision of someone accustomed to life and death decisions. Let me make sure I understand what happened tonight. My 8-year-old son arrived at this emergency department at approximately 8:47 p.m., with obvious signs of a severe fracture. My mother, a woman who has raised 6 children and helped raise 12 grandchildren, told the attending physician that she believed the injury was serious and requested proper medical attention. Dr. Stone shifted uncomfortably in his chair, unable to meet Michael's steady gaze. Dr. Stone, Michael continued, According to my mother and the nursing staff, you examined my son for approximately 2 minutes, refused to order x-rays, diagnosed a sprain without proper examination, and dismissed them with instructions to visit a community clinic in the morning. Dr. Johnson, Dr. Stone began, his voice shaky. I want you to understand that I see dozens of pediatric cases every week. Sometimes when you're tired, stop. Michael's voice cut through the excuse like a scalpel. Dr. Stone, I've been practicing pediatric medicine for 12 years. I know what it's like to be tired. I know what it's like to have a long day. What I don't know is how a physician with your experience could look at a compound fracture and diagnose it as a sprain. Administrator Williams leaned forward. Dr. Johnson, please know that we're taking this situation very seriously. We'll be conducting a full investigation into what happened tonight. Michael turned his attention to her, his expression unchanged. Ms. Williams, let me ask you something. Do you think this would have happened if my son had arrived here wearing different clothes? If my mother had presented a private insurance card instead of Medicaid? If we had looked like the families from the suburbs instead of an elderly black woman and her grandson from the inner city? The room fell silent. The question hung in the air like smoke, impossible to ignore or dispel. Dr. Martinez, who had been quiet until now, finally spoke up. Michael, I need to tell you something else. I tried to intervene earlier in the evening. When I saw Tommy and your mother in the waiting room, I could see that something was wrong. But when I approached Dr. Stone about ordering x-rays, he refused and told me the case was closed. You tried to get him to reconsider? Michael asked. Yes. I told him the child appeared to be in serious pain and that x-rays would be a reasonable precaution. He told me I was overstepping my boundaries and that he knew the difference between a sprain and a fracture. Dr. Stone's face flushed red. Angela, that's exactly how it happened, Richard. Dr. Martinez interrupted, her voice firm. I was there. I heard every word. Michael looked directly at Dr. Stone. Doctor, I want you to help me understand something. My son sat in your emergency department for 4 hours with a compound fracture that could have resulted in permanent disability or loss of his leg. During that time, my elderly mother repeatedly asked for help, and your nursing staff expressed concerns. Yet you maintained that this was just a sprain. How do you explain that? Dr. Stone's hands trembled slightly as he tried to find words. Dr. Johnson, I made a mistake. I was at the end of a long shift and I didn't examine him as thoroughly as I should have. That's not what this is about, and we both know it, Michael replied quietly. This isn't about being tired or making a medical error. This is about the assumptions you made the moment you saw my family. The truth hung in the room like a heavy weight. Everyone present knew that Michael was right, but hearing it spoken aloud made it impossible to ignore. Administrator Williams cleared her throat. Dr. Johnson, what can we do to make this right? Michael was quiet for a long moment, thinking not just as a father but as a physician who understood the broader implications of what had happened. Ms. Williams, my son will recover. Dr. Martinez's intervention, while delayed, prevented permanent damage. But here's what concerns me most. How many other families have sat in that waiting room and been dismissed because of who they are or what they look like? How many children have suffered because assumptions were made about their worth or their need for care? He paused, looking around the room. I've worked in hospitals across this state. I've seen the statistics on healthcare disparities. I know that what happened to my family tonight happens to other families regularly. The only difference is that most of those families don't have a chief of surgery for a father. Dr. Stone finally found his voice again. Dr. Johnson, I want to apologize. Not just to you, but to your mother and your son. What happened tonight was wrong, and I take full responsibility. Dr. Stone, your apology is noted, but apologies don't change the fact that my son spent 4 hours in agony because of your prejudice. They don't change the fear my mother felt, watching her grandson suffer while being told she was overreacting. The room fell silent again, as the weight of Michael's words settled over everyone. Present Dr. Martinez spoke up. Michael, what do you want to see happen here? How do we make sure this never happens again? Michael looked at each person in the room before answering. First, Dr. Stone needs to be removed from treating patients until he completes comprehensive training on implicit bias and cultural competency. Second, this hospital needs to implement protocols that prevent any physician from dismissing cases without proper documentation and oversight. Third, There needs to be a system in place for patients and families to escalate concerns when they feel they're not being heard. Administrator Williams nodded, taking notes. Those are reasonable requests, Dr. Johnson. We'll implement them immediately. But most importantly, Michael continued, this can't just be about policies and procedures. Every person who works in this hospital needs to understand that every patient deserves respect and proper medical care, regardless of their race, insurance status, or appearance. Dr. Stone looked up with tears in his eyes. Dr. Johnson, I've been practicing medicine for 15 years. I became a doctor because I wanted to help people. Somewhere along the way, I lost sight of that. I let my prejudices cloud my judgment, and your son suffered because of it. I know my apology isn't enough, but I need you to know that I'm going to spend every day for the rest of my career making sure this never happens again. Michael studied Dr. Stone's face for a long moment. He could see genuine remorse there, but he also knew that good intentions weren't enough to change systemic problems. Dr. Stone, your regret is a start, but the real test will be whether you follow through on that commitment, whether you examine your own biases and work to change not just your own behavior, but the culture of medicine that allowed this to happen. Just then, Dr. Martinez's pager buzzed. She looked down at it and smiled for the first time that evening. Tommy's surgery went perfectly. He's in recovery now and his prognosis is excellent. He should make a full recovery with no long-term effects. Michael closed his eyes and took a deep breath, feeling relief wash over him. His son was going to be okay, but as he looked around the conference room at the faces of his colleagues, he knew that the real work was just beginning. Tonight had exposed a problem that went far beyond one doctor's poor judgment. It had revealed the systemic biases that existed throughout the healthcare system, biases that affected countless families who didn't have the privilege and professional standing that had ultimately saved his son. As the meeting concluded and everyone began to leave, Michael made a silent promise to himself and to his son. He was going to use his position and influence to make sure that what happened to his family never happened to anyone else's. The fight for equitable health care had just become personal, and he was ready to wage that battle with everything he had. 3 months after that terrible night in the emergency room, Tommy Johnson was running around his grandmother's backyard, chasing fireflies with his cousins. His leg had healed perfectly, leaving only a small scar that he proudly showed to his friends as proof of his adventure. But while Tommy's physical recovery had been complete, the events of that night had set in motion changes that would ripple through the entire healthcare system. Dr. Richard Stone sat in his car outside a community health clinic, preparing for his first day of volunteer work. The past 3 months had been the hardest of his professional life. The hospital's investigation had led to a formal reprimand, mandatory bias training, and a 6-month suspension from the emergency department. His colleagues avoided him, and he had become the subject of whispered conversations in hospital corridors. But the real wake-up call had come when he started examining his own practice history. With the help of a therapist who specialized in helping professionals confront their implicit biases, Dr. Stone had reviewed hundreds of his past cases. What he found horrified him. Pattern after pattern emerged of shorter examinations, quicker dismissals, and less thorough care for patients who didn't fit his unconscious image of who deserved his best efforts. The community clinic where he now volunteered served predominantly low-income families, many of them the same demographic he had dismissed so callously that night. Working there had opened his eyes to the barriers these families faced in getting quality health care, and he was slowly beginning to understand the real impact of his past behavior. Meanwhile, Dr. Angela Martinez had been promoted to Director of Emergency Medicine Quality Improvement. Her courage in standing up for Tommy despite professional pressure had earned her recognition from the hospital administration, who realized they needed leaders willing to speak up when they saw problems. Under her leadership, Riverside Medical Center had implemented sweeping changes. Every emergency department case now required documented justification for dismissal without examination. A patient advocate program had been established, giving families a direct line to escalate concerns. Most importantly, all staff members were required to complete monthly training sessions on cultural competency and implicit bias. The changes we've made aren't just about policies, Dr. Martinez explained to a group of medical students during a training session. They're about remembering why we became healthcare providers in the first place, to help people, all people, regardless of who they are or where they come from. The story of what had happened that night had spread throughout the medical community, not through gossip, but through Dr. Michael Johnson's deliberate efforts to use the incident as a teaching moment. He had spoken at medical conferences, written articles for medical journals, and worked with other hospital systems to implement similar reforms. Healthcare disparities aren't just statistics, he told an auditorium full of doctors at a regional medical conference, their children sitting in emergency rooms while their families beg for help, their elderly grandmothers being dismissed because someone assumes they don't know what they're talking about, their families who learn to accept substandard care because they've been taught that it's all they deserve. His presentation always included the same slide, a photo of Tommy in his hospital bed the morning after his surgery, smiling despite his pain, with his grandmother holding his hand. The image never failed to move his audience. But Michael's message was always clear. This story had a happy ending only because of privilege and position that most families don't have. The changes weren't limited to Riverside Medical Center. The state medical board had launched an investigation into healthcare disparities across all hospitals in the region. New protocols were being developed for reporting and addressing cases where patients felt they had received discriminatory treatment. Dr. Patricia Williams, the hospital administrator, had initially been terrified that the incident would result in lawsuits and bad publicity for the hospital. Instead, Riverside had become a model for other healthcare systems looking to address similar issues. Medical professionals from other states were visiting to learn about their new protocols and training programs. We learned that trying to hide from our problems only makes them worse, she explained to a visiting delegation of hospital administrators. When we acknowledged what happened and committed to real change, it allowed us to become better at serving all of our patients. The Johnson family had decided not to pursue legal action, choosing instead to focus their energy on systemic change. Mrs. Betty Johnson had become something of a celebrity in her community, speaking at church groups and community organizations about the importance of advocating for yourself and your family in medical settings. Don't ever let anyone make you feel like you don't deserve proper care, she would tell her audiences. I almost lost my grandson because I didn't speak up loud enough at first, but I'm proud that I didn't give up. And I'm proud that my son used this experience to help other families. Her story had inspired other families to share their own experiences with healthcare discrimination. A support group had formed at her church for people who had faced similar situations, and they worked together to educate community members about their rights as patients. Tommy, now fully recovered, had little memory of the pain from that night, but he had absorbed the lessons his family taught him about standing up for what's right. When his teacher asked the class to write about their heroes, he wrote about his grandmother. My grandma is my hero because she didn't give up when the doctor wouldn't help me. She sat in that hospital all night until someone listened to her. She taught me that sometimes you have to fight for people you love even when it's hard. Dr. Stone's journey toward redemption was far from over. The volunteer work at the community clinic had become more than just a requirement. It had become a calling. Working with families who reminded him daily of the assumptions he had made. He was slowly earning back the trust he had lost, one patient at a time. I can never undo what I did, he confided to Dr. Martinez during one of their monthly check-in meetings. But I can spend the rest of my career making sure I never make those mistakes again. Every patient I see now gets the same level of care I would want for my own family. The transformation wasn't just professional, it was personal. Dr. Stone had started examining all areas of his life where he had made assumptions about people based on their appearance or circumstances. He had uncomfortable conversations with his own family about privilege and bias, and he began volunteering in his community beyond just the medical clinic. 6 months after the incident, Dr. Michael Johnson received an unexpected phone call from Dr. Stone. Dr. Johnson, I know I'm probably the last person you want to hear from, but I wanted to thank you. Michael was surprised. Thank me for what, Dr. Stone? For not destroying my career when you had every right to. For giving me the chance to become a better doctor and a better person. I know that might sound strange, but what happened that night, as terrible as it was, forced me to confront things about myself that I had been ignoring for years. Michael was quiet for a moment before responding. Dr. Stone, I appreciate your call, but the real thanks should go to the patients you're treating better now because of what you learned. They're the ones who benefit from the changes you've made. You're right, Dr. Stone replied, "and I want you to know that every day, I remember your son's face that night and your mother's voice asking for help. It reminds me why I became a doctor in the first place." As the first anniversary of the incident approached, Tommy was completely back to his normal, active 8-year-old self. He rode his bike with confidence, played soccer with his friends, and showed no lasting effects from his injury. But the changes that had started with his family's experience continued to spread. Other hospitals had adopted similar protocols. Medical schools were incorporating bias training into their curricula, and patient advocacy programs were becoming standard practice. During a family dinner at Mrs. Johnson's house, Tommy looked around the table at his father, grandmother, and cousins, unaware that his difficult night had sparked a movement that was making healthcare better for families across the country. "Grandma," he said, reaching for another piece of her famous cornbread, "remember when I broke my leg and we had to stay at the hospital all night?" "I remember, baby," she replied, smiling at her grandson. "I'm glad you didn't give up on me," Tommy said simply, the way children do when they express the most profound truths without realizing it. Mrs. Johnson reached over and squeezed his hand. "I will never give up on you, Tommy. And because of what happened that night, hopefully other grandmothers won't have to fight as hard as I did to get help for their grandbabies." As the family continued their dinner, none of them could have imagined how far the ripples from that terrible night would continue to spread, or how many families would benefit from Tommy's broken leg and his grandmother's refusal to accept inadequate care. Though, story had become more than just one family's experience. It had become a catalyst for change, proving that sometimes the most powerful revolutions begin with a grandmother who simply refuses to take no for an answer when her grandchild needs help.